I'd love to introduce our two integral members of our healthcare team at the UCSF Neuro-Oncology Department who will be talking with you today. Lacy Fetting is a licensed clinical social worker in the UCSF Neuro-Oncology Department. Lacy has a keen interest in palliative care, as well as an interest in supporting patients with their communications with their family and children. Desiree Angelo is also a clinical social worker working at the UCSF Helen Diller Family Comprehensive Cancer Center, and she is a member of the UCSF Neuro-Oncology Gordon Murray Caregiver Program, which provides education, support, and resources for caregivers of brain tumor patients. So Desiree and Lacy, thank you so much for being here today to offer our community the valuable information of the role of the medical center social workers and the assistance that they can provide. I'll turn it over to you.
Thank you, Naomi. Thank you for your introduction. I appreciate that. I speak for Desiree, I think, and myself when I say we're grateful for the opportunity to talk with you tonight. I've met some of you as I've attended group, but tonight I'm going to pop out of my square. At UCSF, we use the word team a lot when we talk to patients and care partners. What that means is there's just not one provider from UCSF who contributes to your care plan. Besides the neuro-oncologists, there's radiation oncologists, nurses and nurse practitioners, neurocognitive psychologists, caregiver program staff, survivorship program staff, practice coordinators. Really, all the UCSF staff that support you and your care partner are your team. And as a social worker, I'm part of that team. And you may say, great, but really, what does this have to do with me? What does it mean to me? How can a social worker help? And that's what we're going to talk about tonight. I'd like to share with you specific services a social worker can provide. In addition to describing specific interventions, I'll use three what I call composite case examples so you can better understand these services in real time. Then I'll pass it off to Desiree. But during the presentation, I just want to ask you if you can hold your questions in the chat until the end. And after the presentation, Desiree and I will be glad to answer those questions. Resources that are discussed here will be provided by email with thanks to our very valuable team member, Mary Destry. So thank you. Social workers start by listening to identify a particular patient's needs. Patients and their care partners and the social worker become their own team in an effort to address these needs. Quick examples of how social workers can help are by providing individual, one-on-one, brief supportive counseling, and in groups, a support group like tonight, facilitating a group. By identifying resources for transportation, for disability, for financial supports, how to optimize health insurance, how to file for FMLA and file for disability, how to access caregiving supports or help at home and to sort out who pays. Social workers also help people identify their goals for care, what matters most, and who they want to partner with to express those wishes in advanced care planning. That was the short version of how a social worker might help. The best source of information for how a social worker can help is you. So before I begin, I'd really love to hear from you if you would like to share the way a social worker did help. Would anyone here like to provide a brief example of how a social worker has helped them? Thank you. Anyone else want to share how a social worker has helped them? Well, with no further ado, I will continue. And so you might ask, do I have a social worker? And I realize that all the people that are here at the group tonight might not be UCSF patients. Many of you get your care at Kaiser or Stanford or Sutter or Marin. And you may ask, well, what about me? Do I get a social worker? And I really encourage you to check your oncologist to see what social work services are available through your clinic. But also realize that there are resources from social workers in the community. So Cancer Support Community in San Francisco, their CEO is a social worker, so that's sort of interesting. And in addition, their support groups are facilitated by either licensed clinical social workers or licensed marriage family therapists. They also have kids groups and teen groups at the Cancer Support Community. Cancer Care is an organization based out of New York. It's been around since 1944. It's staffed by oncology social workers. They have free professional, emotional, and practical support services. What they have for us in California, a resource navigation, online support groups, which aren't like Zoom. They're not in real time. They're back and forth like the old listservs, if you will. They have coping circle monthly workshops on various topics. They have really good education workshops from oncologists with like highlights from ASCO. They have a tremendous Helping Hands financial directory that's thick. Again, this is national, but it's very helpful. They have programs for financial and copay assistance. They'll be based on funding because most financial support programs are based on donor dollars. And if they run dry, you might say, oh, this lady said there's some money here. Let me write away and see if I can get it. And they'll say, oh, we're out of funds. But please check back with these organizations because donor dollars come in and get used and then come in again. So I just wanted to sort of go through that with you. There's also the Brain Tumor Network. They're from Florida, or an organization out of Florida to help people. And then please realize that when you have home health come to your home, what is that? Visiting nurse, PT and OT, maybe after surgery or after hospitalization, you're home and you're recovering at home because it's a little bit of a challenge to get out of the house. So you're eligible with doctor's orders for something called home care. Know that when you have home care, you can also have a social worker come to see you. They might help with transportation, emotional support, practical resources. They're available to be in your home just like a physical therapist is and an occupational therapist and a visiting nurse. Social work services are part of home-based palliative care programs and part of hospice. And then there's other organizations like the ABTA and the National Brain Tumor Society that have a lot of services that are social work-like. I'm not sure that every staff person there is a social worker per se, but they provide a lot of supports and services. So these are just pictures of their web pages just to kind of orient you. That's the Cancer Support Community. This is Cancer Care, over 75 years of help and hope. It's a great, great program. Brain Tumor Network, it has no-cost social work navigation services. Skilled home care and hospice, we discussed. The National Brain Tumor Foundation, Society and American Brain Tumor Association. So I just wanted to review those resources with you. And has anybody used any of those? Margot? Okay. Well, and Lisa, the links to these services or these websites will be sent to you in a resource listing from Mary Destry. So I hope that you find them helpful. So I want to speak to you a little bit from my own experience and kind of focus on my habits as a social worker. They're based on 20 plus years as an oncology social worker. Sometimes patients will say to me, I bet you've heard all this before. And I can honestly answer, I have never heard this before. I have never heard this before. Because each individual situation is totally unique. Also, each day, I learn all kinds of new information. There is many a time when I say, I should know this, but I don't know. And more often than not, when I meet with a patient and care partner, I need to research the issue and get back to them. I think it's really important for us all to sort of recognize that insurances change what they're going to cover and what they're not going to cover, like we change our clothes on a daily basis. And so it's very often that you don't know everything. And it's always important to go back to the source and ask again. And so I like to make that a habit of my practice. How frequently I see someone, how frequently does somebody see a social worker? Well, I might meet some people once or twice with the specific need, and that's it. But for others, my supports are more comprehensive, they're over time and longer term. Social workers need to listen closely. I try to do what they call holding space. That's become kind of a popular term now. And what we're doing tonight is holding space for all of us. But I try to hold space for a person's experience and keep my mind open and my ears finely tuned and an open heart. I can't overestimate how important I think listening is. I really want to leave the interaction, and I think most social workers want to leave the interactions with the patient and family feeling heard, that someone gets it and truly is on their team. And to make sure I understand, I follow up with questions and clarify. Am I getting this? Do I have it? Is this your experience? Is this your need for support? And I welcome the back and forth as, nah, that's not quite it. You're missing this. And I like to keep going until we have a sure and clear understanding that we get each other. There's an adage, a saying well known to each social worker in graduate school, and that is to start where the person is. And the picture in front of you is a doctor listening, but guess what's on the front and forefront? The patient's agenda. And I think that's very, very important. I like to start where the person is. What's on your mind? How can I help you? What concerns do you have? And my agenda is your agenda. And because of that, I wear a lot of hats. There's a lot of different things that I've learned how to do. And if I'm doing my job properly, I'm really like a chameleon. At UCSF, there are certain kinds of help, certain practical supports that are frequently in demand. First is, how do I get there? Treatment can range in frequency from 6 weeks of daily radiation to follow-up scans and checkups every other month or so. So transportation can be pretty darn important. And as a social worker, I provide information and education about what resources are available and help problem solve with patients and care partners when community resources are not available. A big part of my job is saying, here's something that can help, and I'm so sorry there's not support for this situation. And that becomes just a starting point for problem solving and trying to figure out what's needed. This information can get pretty darn specific. It can include where to park at UCSF, what valet services are about, what are available, and when are they available, what the costs are, how to access disability plates and placards that the doctor recommends. And I learned in working with some of you all that it's not only important to fill out the forms, and I can provide the go-between services between the form you give me and getting the doctor to sign it and complete it and getting it back to you, but then also making sure you understand, what do I do with this form now? That you need to either go to AAA if you're a member of AAA to get the placard, or to your local DMV. So there's a lot of very specific details. It gets very, as they say, granular. We help with lodging and problem solving, where to stay at UCSF, because people come from far, far away. Providing hotel listings, listening to people's individual solutions, which might include Airbnbs. People have a lot of needs. Our cause house, which is for folks who are getting longer term treatment at UCSF, to include transplants of solid tumors and then people who get radiation. The cause house is available not always because it fills up, but also some people, have a challenge with the fact that you have to eat in the community kitchen. You can't eat in your room. And so some people say, hey, that's a deal killer for me. I'd really rather go to an extended stay where there's a full kitchen. So listening to the needs of people and their care partners and their families and the people who are helping them to be able to find a good solution. And indeed, listening also to the ADA requirements that people have. I find more and more there's a lot of advocacy that I need to sharpen on my part, because what a hotel says is ADA is not always ADA and not always filling the need. So I've learned from my experiences on that. And that's an important part of what all social workers should be doing, learning from these particular experiences. When I said, this has never happened before, your situation is unique. You as a person are unique and your situation is unique. I mean that, and I learn from that every day. A big thing for folks is health insurance. So there's a lot of variations to health insurance. It can be employer-based, as long as you're employed. Sometimes when folks aren't going to be working anymore, they lose their employer-based insurance. They may be able to be picked up by their spouse's employment-based insurance, or individuals who are under 26 who are away and in their own jobs and have their own insurance through their employer could get on their parents' insurance until the age 26. Covered California subsidies are available. Medi-Cal is another health insurance that can be accessed through the Covered California website. Medicare, for those that are disabled and collecting SSDI for 24 months. On the 25th month, they get Medicare. And in addition, trying to sort through whether COBRA is affordable or not. COBRA is very complex and costly. It's employer-based insurance that loses the employer contribution. So you have to shoulder that, meaning the consumer, and it can get expensive. There's a lot of problem solving about health insurance supports. I make referrals to UCSF financial counselors. The question people have is UCSF taking my insurance? And when and if insurance changes as a result of moving or deciding not to work, what are my options? How to keep, switch, enroll in new health insurance. Referral to community organizations and resources like Covered California or HICAP. And also referrals to agencies that help protect patients' legal rights, legal protections. Referrals there can sometimes be very helpful when people are trying to figure out health insurance. There's a lot of ifs, ands, or buts. Support, individual and group. Most people ask for psychosocial supports as soon as they're diagnosed and as they adjust. They might not want it that day, but people want to know what is available and how to access it. I provide sometimes brief supportive counseling, but for those who seek a longer-term therapist, I provide information on how to access a therapist in the community through their health insurance and providing a network of therapists to choose from. An example is Psychology Today. They have a therapy finder, if you will. For those who seek a support group, I want to make sure that patients and caregivers are aware of the groups offered by UCSF, whether it's Neuro-Oncology through OSHR, the caregiver support groups, survivorship support groups, and also cancer support community, other organizations in the Bay Area, Berkeley-based Women's Cancer Resource Center, National Brain Tumor Society. Many people want peer-to-peer networks. So UCSF has that matching service, if you will, for caregivers and for patients, and national organizations do too. The American Brain Tumor Association also offers peer-to-peer matching services. Psychosocial supports are also talking about talking. By that, I mean how a person talks to themselves about their diagnosis and care plan, how they talk to their family, and their choices to share this information with their community or not. Work colleagues, friends, acquaintances, their children's best friend's family. their children's school, their faith community. Indeed, the question really is how much to say to whom. And sometimes I strategize with patients on these communications. People sometimes are coming home from surgery. They're finally able to even get out and go with their care partner to the grocery store, and they can't get down the aisle without people asking lots of questions. How are you? And they're like, I really just want to get to the grocery store and get through this. And so sometimes we strategize how to respectfully answer that question and also set boundaries. Maybe you really just want to get through the grocery store, or maybe you're at work and people really want to know what's going on and what's happening with you, and you've been out and you may have disclosed a certain amount and they want to find out what's happening. And it's really hard for you just to get through that day back at work. And so it's sometimes helpful to strategize. I'm so glad to see you. Today, I really want to focus on catching up to where we were before. It's really not so helpful for me to get into a lot of details with you right now, and I'm really most anxious. What could really help is you and I catching up on your son or daughter or the TV show that you talked about or whatever it is. So just a way to strategize communications and situations that make just navigating the world maybe a little easier in terms of communications. I'm not sure that resonates with anyone, but for some people that's important. So I said to you that I would use some composite case examples to illustrate social work supports in real time. And composite case examples, these three individuals that I'm about to talk about are not real people, but their situations are very real. And the work that I've done with them, I've done with many patients in my experience as an oncology social worker. But I thought it might just help put it in context. So consider CL. She's age 24 and a half. She lives with roommates in a small town 100 miles from her parents' home. She's been working as a store manager for 2 years. In early June, she had a seizure, went to the ER, was transferred to UCSF for a diagnostic workup. The team recommended surgery. The pathology was brain tumor, and chemo and radiation was recommended. So I met with her. And so as I listened, I could feel that she was most concerned about her job and finances and her independence that she just achieved by, having her first job and being a store manager. She was really a little bit overwhelmed with it all. She wasn't sure if she'd be able to work after radiation, and it scared her. She didn't know what to tell her workplace, what words to use. So I first encouraged her to talk to her oncologist to kind of get the oncologist's recommendation to work or not to work. And after this, we were able to break it down into parts, if you will, step by step. She asked me for information about FMLA. We worked through filing for California SDI. She took 3 months for disability. She moved back home, which was really hard, so she could have support for transport and access to radiation and UCSF. And I suggested the young adult brain tumor group that is a peer-to-peer group at UCSF. How else could I help? Again, recognizing that the new diagnosis is completely overwhelming, especially for a young person. To let her know that I can facilitate team coordination. It's always very important when you have a medical concern that you call the clinic line or the nurse's line. But when it's non-medical, I'm happy to sort of get back and forth and get in the middle of forms that need filled out, just to make life a little easier for everybody. To ask her, what matters most? How can I help you prioritize kind of your to-do list? And to ensure that she understands that our discussions are not a one-time thing. That managing tasks, maybe it could be done in a day, but should you do it in a day? It's a little bit overwhelming. And to try to do a step-by-step approach to it, one day at a time. Key again is to work or not to work. And so in general, talking with the doctor, Exploring eligibilities and options, because for each person, it might be quite different. Some people have access to California SDI, some people don't. Some people have short-term disability, some people don't. To know what FMLA is in terms of job protections, to know that you don't have to disclose your full diagnosis to your employer to get FMLA. To recognize that there are income replacement programs, various kinds of disability programs for various periods of time with lots of different eligibility, ifs, ands, or buts, if you will. To recognize that care partners can have job protections too in California under paid family leave, and they can be eligible for income replacements as well. To recognize that the initial plan might change. You might switch swim lanes midstream, and to cultivate as best I can flexibility. I think sometimes that can be helpful. So these are just pictures of different websites. My favorite EDD website, disability benefits. There's some really good information from Social Security Administration that makes things pretty clear. Covered California has a portal that is helpful for people to figure out whether they're Medi-Cal eligible or subsidy eligible for insurance. And now we'll come to JJ. JJ and his wife live in Alameda County. They have a 9-year-old son. JJ is diagnosed with a brain tumor. He's very anxious about how to talk to his son, how to tell him about his diagnosis. He's also worried about he and his wife and how they can continue to keep up with his son's really busy schedule. His son has many friends, and the parents know each other from the soccer field. JJ worries that the diagnosis and treatment will make life financially challenging as well. Mostly, JJ doesn't want his cancer to change or disrupt family life. He doesn't want to burden his family. He doesn't want to worry his wife. He doesn't want to scare his son. We talked about what he could do to minimize that sense of burden. Talk about it. Mr. Rogers said, if it's unmentionable, it's unmanageable. And I think recognizing openly that family life will change is really important. It's important also for whatever his son sees with his eyes, feels with that kid antenna when they know, you don't even have to use words. Kids walk into the room and they know when something's up. Mom's in a bad mood, or something's up, something happened to dad today. Kids vibe it, if you will, V-I-B-E, they vibe it. So what he sees and what he vibes and what he catches with his antenna, the best thing that can be done sometimes is just to have that match the words come out of your mouth. So what you say reinforces what he feels. And with that match, well, that's real. That's real. Things are tense. Life is changing. This has disrupted things. But when it's real, it's trustworthy. And when it's real and you communicate openly with your kids, they also realize you have confidence. They can handle it. And as a family, you all can handle it. So it's every parent knows their child best. Number 1, number 2, number 3, number 4, number 5. So there's no prescription here in terms of openness, but it's helpful for those reasons, I think. So as a social worker, I try again to listen carefully. Tell me about your son. Tell me about your son. In terms of communicating the diagnosis or any change in the treatment plan or change in condition, what words have you used? What do you want him to know? And then to try to get in your mind the sentences, the words in the sentences that you're going to use to bring information to him, to share the diagnosis, to share the treatment plan, to share the recurrence, to share the remission, to share the scan being good, all the things that you want to communicate to him. What words are you going to use? And can you say it in 2 sentences so that you can provide support and listening and attention to however that child responds? How to involve families and how to involve schools. An elementary school child might be very happy that you talk to the guidance counselor. A junior in high school might be livid. So, you just have to weigh what's in the child's best interest and make them as much a partner in this as you can, is a recommendation that I have. And this is based on years of experience in reading. I like to offer certain books that are written by folks who are experts in the area of communicating with kids, whether they're child psychiatrists, individuals who are doctors and also cancer patients, child life specialists. Sometimes having a book on the shelf is just like knowing what psychosocial supports are available. I might not want it today, but I want it for down the road, and to have in the middle of the night when something comes up and I can go to it and say, help, and get some support. This is a website from Mass General, founded by a child psychiatrist who's written a book as well, all about communicating with children and parenting at a challenging time. So again, this is in the web resources for you. It takes a village, and helping JJ understand that task calendars that don't involve you being involved in every detail of your child's life as your friends try to help you coordinate carpools, etc., and casseroles, these task calendars through online kinds of sites can be very, very helpful. And also talking about fundraising and different guidelines approach that, financial concerns, income-based government programs, food stamps, etc. Organizations with financial grants, which again may or may not have funds or may have long application processes that you may or may not want to, disclose all that information, but they can be helpful. The last individual we'll talk about tonight is PT. He's in his 70s. He's the caregiver for his wife, who has mild dementia. She's in her 60s. They live with their daughter and son-in-law and their teenage children, and their nephew who's staying with him as he attends college nearby. PT has Medicare and Medi-Cal, and he was diagnosed with a brain tumor and he needs radiation. His daughter took FMLA to provide that support. He had been his wife's caregiver. Because he has Medi-Cal, he was eligible for something called in-home supportive services. So his wife's going to need a new caregiver through IHSS for the hours she's been approved of on a monthly basis. And so when the daughter needs to return to work, they're going to need help not only for PT, but also for his wife. So one of the things that I was able to do when they were here in the clinic was to meet with them and call IHSS and make that initial call to explain the kind of supports he needed help with, that she needed help with, and to set the ball in motion, if you will, to access that care through that program. And again, that program is listed in your resources. In-home supportive services. For folks who aren't eligible for in-home supportive services, there is the Family Caregiver Alliance, also has lots of interesting information about caregiver supports. It's quite a good resource. So his priorities were really to get through treatment, to get help at home. He also wanted to know, hey, through my Medicare, don't I get some skilled care? What about PT and OT? What about that social worker coming into the home to finish up this IHSS? So making sure that just because people have one version of care through Medi-Cal and IHSS, they might be eligible for skilled care as well. And you want to get the biggest bang for your insurance buck. You want to help people make sure that they access that for these needed services. So we looked at that. And then other people sometimes have a long-term care policy or sometimes getting extra help at home. It's just an in-pocket situation. And it can be pretty expensive, so that's a challenge. Oops, I went a little too far. I helped complete his advanced directive. Witnessing advanced directives at home can be tricky because you can't always use your family members if they're to benefit from your estates. You have to read the fine print. So witnessing with family, neighbors, notary is a step that needs to be taken. And then people send it to their PCP or the team. And what filling out an advanced directive can really help with is it opens up a conversation. It's not just a form, it's a conversation. It helps people clarify what their goals of care are, what kind of quality of life are they looking for that care to provide, what do they value, and what don't they value, like ICUs at times or EDs. And to clarify with the family so everybody's on the same page about what PT wants or the patient wants, so it isn't at the last minute kind of chaotic. People have the sense. Social workers provide information about palliative care, what it is, what it isn't, as well as hospice care. What kind of supports are available through hospice, what interventions are covered, what interventions are not. You can just provide a little bit of information. Sometimes, again, people like to get ahead of it. I want to hear about hospice. I'm not ready for hospice yet. We're still in the treatment mode. I really want to continue my treatments and be open to getting additional treatments, but I want to know about that. It's like that book. I want to know what's in it, and I'm going to put it back up on the shelf and pull it down later. But I'd like to know. And so hospices themselves, not social workers like myself, but hospices themselves routinely provide informational visits for hospice, and social workers can help people appreciate that and access it if they choose. So that's it for me. I'm going to turn it over to Desiree now. I thank you all for your time, and I'm looking forward, after Desiree talks, to hear any questions that you might have.
Yeah, thank you, Lacy.
Sure.
And thank you, everyone, for inviting me to your group tonight. So my name is Desiree, and I'm the dedicated social worker for our caregiver program. The caregiver program really sees itself as being a part of the patient's treatment team, but our role on that team is to help support and help take care of whoever is helping to take care of you. Our philosophy is that when family caregivers are well supported with information, education, and emotional support, not only do our caregivers do better, but patients tend to do better as well. Before touching on some of the ways that we provide support, I did want to comment quickly on the term caregiver. So not all patients and not all of their primary family caregivers identify with or use that term. Lacy used the term care partner throughout her talk. Caregiver is pretty widely used by medical institutions and support agencies. But care partner is increasingly being used. And really these two words describe two different kinds of relationships. So when we say caregiver, this really implies that there might be some more dependence on your family member for support. And when we say care partner, this describes a relationship that there might be some more independence and there might be some more equal collaboration between the care recipient and their loved one. So for example, after surgery, that might be a time where it's most appropriate to use the term caregiver, or when that relationship that caregiver is describing is most important. There are probably also a lot of times when it's more appropriate to use the term care partner to describe your own individual needs and to describe the role that your loved one plays with you and with your treatment team. Because our program uses the term caregiver, I'm going to continue to use that tonight. But I did want to just acknowledge this difference in the language that we use in case the term caregiver doesn't resonate with anyone on this call. So what services and supports do we provide? So every patient that comes to our clinic, even if it's just for one consult with our doctors, gets an outreach call from me. And during that call, I assess for any practical care needs or emotional care needs. If someone's care is going to be primarily at another clinic, I may direct families back to that clinic. I might help them navigate who to contact, how to contact those people, and I might also connect them with general caregiver resources. Some of those resources include the ones that Lacy talked about. Every family that comes to UCSF also gets our caregiver packet, which includes this handbook here, our orientation to caregiving. This is a really, really practical guide that supports our families and our caregivers with understanding what a brain tumor is, how it might impact their loved one, and then it offers some real concrete tips and strategies for organizing care at home. So as the social worker for the program, I help caregivers navigate caring for their loved one ongoing by providing a lot of practical support. So some of the things that Lacy mentioned, I can also help with. Really anything practical or logistical that might come up around this diagnosis, we want to be available for. I also provide individual sessions for caregivers for emotional support. As everyone on this call knows, this diagnosis isn't just practically or logistically a lot, but it takes an emotional toll as well. So my role really is to support caregivers, to support family members so that they feel empowered to take care of their loved ones as best as they can. Naomi, can we go to the second slide again? Thank you. So I just wanted to double click on some general caregiver resources, especially if there's anyone here who is not a UCSF patient. So again, the orientation to caregiving packet, which I think I just saw that somebody dropped a link to that in the chat. So that's available to anyone. The Family Caregiver Alliance. This is a really, really wonderful resource. So they have a ton of support groups that they run, including a young adult support group. They do educational webinars. They'll do like 4 to 6 weeks workshops on a certain coping skill. They can also connect people with a local caregiver resource hub. So each county in California has sort of like a resource center for family caregivers. And so the Family Caregiver Alliance is a really good kind of one-stop shop for accessing all of those resources. The Caregiver Action Network is very, very similar to the Family Caregiver Alliance. One additional resource that they offer that I wanted to highlight, and we can send out in the resources after group, is they have a crisis hotline. So they have a crisis hotline that is specifically for family caregivers. I'm sure people are familiar with like suicide hotlines, even if you've never used one. So this is a hotline that's dedicated just to providing emotional support and emotional safety for family caregivers who might be experiencing some distress around their loved one's illness. And then lastly, like Lacy mentioned, I just wanted to also remind people, that most hospitals and clinics do have some amount of social work support. And so if anybody on this call who's not a UCSF patient is interested in getting more support, either short-term counseling or emotional support, or looking for a caregiver support group, we encourage you to reach out to your doctor or to the clinic to see if there are resources that the social worker can offer you. So that's all I had for my part, and I'm gonna put I'll put my contact information, my phone number, my email in the chat. I'm excited to hear people's thoughts and questions tonight, and I'm definitely available after this evening to answer any questions as well.
Thank you so much for both Lacy and Desiree for your information. It's just amazing to hear how social workers are such an integral part of the team. These people, their skills are so are part of the holistic plan of helping a person who's had a brain tumor and their family. And as you know, everybody knows that it's a family disease. It's not just a one single person disease. So that's really, really important.